Hello everyone, welcome to Diabetes Awareness Channel. This is our first official video, and if you are not yet subscribed, please do subscribe to us because you're not going to regret you did. All we're doing here is dishing out information about diabetes from head to toe. You will tell him more. Diabetes Awareness Channel is a sister channel to Health Redeem, and all we do on this channel is to talk about everything that concerns diabetes, from diagnosis to management, how you have to be on top of your game, what you need to do so that you don't get problems with diabetes. There are a lot of people who have diabetes, but still you won't even know they have it because they know how to manage it properly. So what we do here is to bring awareness to people and to let people know how to manage diabetes very well without getting complications, and to avoid some other sad story that comes along with diabetes, for example death. So this video has been put up as a result of a sudden death of a very young man under his 50 as a result of diabetes. So that is why we are bringing this awareness right to your doorstep. Later on this channel, we will be looking at how what we eat influences our blood sugar, especially with regards to portion size, the amount of food we eat. This is a very common problem we mostly found with the African community. So we want to teach people the right portion size, the right class of food, the different classes of food that tend to spike up blood sugar. So it is very important if you follow all our videos every time we upload a new one. When it comes to managing diabetes, we have to carefully select what we eat. It is not just anything you see you put in your mouth. To the extent of fruits, there are some fruits we eat and we love them so much. They have the potential of spiking up our blood sugar. So that is why it is very it is very necessary that we are careful when choosing whatever we want to put in our mouth. Even if you don't have diabetes, you don't want to have it. Nobody wants to have diabetes. So let us be careful. Listen to experts, and then you know what's right for you and what's not right for you. So if you are interested, please do leave us a comment in our comment box below. There are lists of fruits which, as a diabetic patient or someone living with diabetes, that you are not supposed to take, because why? They have the potential to raise your blood sugar. So it is very, very important you have this list. When it comes to caring and managing diabetes, one has to be very, very careful. I have seen a situation whereby a lot of people, because they have the test kit at home, when their friends come over to visit and they complain, they say, oh, let me test your blood sugar for you. And because it's free, they are not going to pay for it. They do the test. And the fact that you've done that test there and the blood sugar result comes back as high, that does not confirm you're diabetic. You have to follow the normal procedure. What is the normal procedure? You go and explain to your doctor. He will check if you have the signs and symptoms of diabetes. If he suspects that, he will send you straight off to the lab. And when you get to the lab, they know what to do. They will take your blood sample and they will carry out the necessary tests. For example, the HbA1c, which is only used to diagnose type 2 diabetes. But for someone who is pregnant, you cannot use the HbA1c. For someone who has type 1, you cannot use the HbA1c. So it is very, very important you listen to your medical doctor. If you're looking for a nice laboratory in Benin City, please contact us. So like I said, When you suspect you are having diabetes, or you are having the symptoms, signs and symptoms of diabetes, go speak to a qualified medical doctor. They know what to do. They will explain everything to you. If there are conditions you don't understand, they will have to explain how you will manage it. For example, you are diabetic and you are also hypertensive. Go to a qualified medical healthcare professionals. They will explain everything to you, to the extent of your lab results. They will explain everything. Do not self-medicate yourself or do to self-diagnose yourself, and do not assume that you think, oh, I am diabetic. No, don't do that. Make sure you talk to an expert. The reason why you have to speak to an expert is that there are different types of diabetes. The major common ones are the type 1, type 2, and gestational. Though there is also a secondary diabetes, that one will be looked to in a later on video. Type 1 diabetes is mainly managed with with insulin. That's the person have to start injecting. While type 2 diabetes is mainly managed with oral medication. Though sometimes with type 1, you can also sometimes oral medication is added, but oral medication is mainly used to manage type 2 diabetes and also gestational diabetes. And before your prescriber or your doctor prescribes you a medication that you will be using, they take so many things into consideration. Like, for example, if you have weight, that's for those who are on the fat side, there are some class of drug they will not want to give to you, because if they give you that class of drug, it makes you add more weight, and which is not good, because when you are managing diabetes, at the same time you are also you take into consideration high blood pressure. So because of this, it's not all drugs you see that you have to take, because there are factors we take in. When it comes to managing diabetes, it's always with a team. It's a single healthcare professionals cannot manage diabetes. So make sure you know your management team. Who are those involved? Who are those? Is it the nurses, the doctors, the endocrinologists, the pharmacists, the optometrists, the pediatrician? The dietitian. Know them. And if you have any question, do not hesitate to ask your medical team, any of them you are visiting. Ask questions. They are there to explain everything to you, to put your mind at rest, because when one is having a condition, you don't need to add stress to it. So ask. Like I said, managing diabetes is not a one-man show. You need a team of different healthcare professionals who needs to come together to make sure things are okay. For example, if someone is diabetic, you need your endocrinologist, you need your optometrist, who will have to continually monitor and control your vision. You need your pharmacist, who will always be there to explain whatever medication you're taking, because they are the medicine experts. They know what the medicine is going to do to you, and they know what your body is also going to do back to the medicine. And then the nurses are there. They are the ones that know how best to administer these medications to you, especially if someone is on insulin, you don't know how to inject yourself. The nurses are there to train you. The physiotherapists are there. The dietitians, they help you to or tell you the right food to take. The sport and science specialists, they help you to keep fit, how you have to be active, because you need these people. They need to be there for you. If you have been prescribed a medication and you don't understand it, and this is a secret, it's a giveaway, let me tell you, the best healthcare professional you have to go and meet is the pharmacist. It is their duty to explain everything to you when it comes to your medication. Do not just go to the pharmacy and point out to a medication and say, can I have that? Don't do that to yourself. Go to the pharmacy, ask the pharmacist Can you, please, do you have time for me? I have a medication that I will want you to explain to me. And before you go, write out all your questions. Do not go to a pharmacy and say, oh, I want clarithromycin, oh, I want metformin, because in Africa it is very easy to buy all these things without a prescription. It is a very wrong practice and it doesn't help you either. So please learn the best way, not the hard way. So now the result is out. Not you. The result says is positive. There is diabetes. One thing you must start immediately: active lifestyle. Make sure you are active. If you can walk to wherever you're going, go do it by walking. Go there by walking. Make sure you exercise every day. Exercise that will cause you to sweat. If you don't know a very rigorous exercise you can do, dance. You can be dancing, and then every day do it at least 30 minutes a day. The recommended minimum exercise you are asked to carry out is at least 150 minutes in a week. But make sure, if you can do more, do it, but make sure you do it. Make sure you exercise every day. Being active helps a lot in managing diabetes. So please form the habit of doing exercise every day. So things you must do now, because the result is positive: reduce your alcohol intake. Reduce it. The recommended units for both male and female in the UK is 14 units per week. So please do not exceed this for your own sake, not for the sake of who is seeing you, but for you. Everyone wants a long life. Please stay within the recommended limit. If you are in Nigeria, I'm going to put the limit for Nigeria in our next video. Watch out for it. This is very, very, very important. Make sure you control your blood pressure every time, regularly, as much as you can. Make sure you control it, because diabetes and high blood pressure, they mostly go hand in hand, and when they are there, they are silent killers. It is not what someone want to entertain in his or her life. Their major way of hitting is fall down and die, and I reject it for every one of you listening to me. Yes, one thing is to reject it, but you have to accept it and know how to deal with it. So that's what I'm saying here. The third thing we are recommending today is that you have to learn. If you're a smoker, from henceforth, please start contemplating, start thinking about it. Stop smoking. If you need help with smoking cessation, contact us. We are here to help you. Yes, we've almost come to the end of this video. Have you got any questions? If you have any questions for me, do not hesitate to send them to me. Just send them by WhatsApp and I will get back to you within 72 hours. So, yeah, I think maybe, let me know. I don't know what you have in mind. So just get in touch with me and I'm waiting for all your questions, and you should be waiting for my answers. Like I said, within 3 working days, I'll get back to you. My contact details are shown on the screen, or go to the comment box and do so. It's only via WhatsApp. I want to thank you so much for watching. Please, please, please do not forget to subscribe, to like and share this video. Like I said, we're going to be dishing out important information about diabetes from A to Z. We'll be talking about what is diabetes, the different class of medications. What you want to know, ask us. But one thing you're going to do for us is to like and share to all your contact. Share this video. Share it to all your contact. Who knows? Maybe you need it, or maybe you know someone who knows someone who needs it. So that is why you have to like and share this video. And don't forget, make sure you subscribe to our video. We'll be releasing important information about diabetes every weekend. So we are looking forward to your comment, to your subscribing, to your thumbs up, and to you sharing our videos out to your contacts. And if you want us, if there's any topic you want us to talk on that is related to diabetes, do not hesitate to send them all to me. Send them to me via WhatsApp. My contact details are going to be in the comment box below, and it's every weekend. So thank you for watching. I love you all. Thank you so much. I'll see you next weekend. Bye.